I'd like to welcome you back to the show. We have with us today a good friend of mine, Dr. Gerlitz, who I call Yanky. How are you? Welcome.
Good. Thank you for having me today.
Thank you. Thank you. And the reason I asked him to come on the show is because, well, I'm a big fan of his. I have a lot of respect for the fact that he's always doing, when we were younger, he did for his friends. As he gets older, he does for anybody and everybody. And this segment is basically going to be about advocacy. Now, before we get into our chat, I just want to tell a little bit about Yanky, Dr. Gerlitz. Um, I think his heart and soul is with acupuncture. Originally, that's where he started off. Then he got into Western medicine. He Until recently, he's been the medical director of a very large medical facility, and he's the go-to guy. The person who breaks through the gatekeepers. If you need something done, you can either bang your head on the wall, get frustrated that you just can't see that doctor, or you can't get that right specialist. Or if you know somebody like Yankee, if you're lucky enough, then all of a sudden doors open, and I'm eternally grateful for that. And yeah, let's jump in. What's going on?
Well, that's very kind of you. I don't know how many doors I could open for myself, but I could definitely help open doors for other people, and that's been a joy to help people like that.
Yes, yes, we appreciate it. So basically, we were talking on the phone, and there's this idea of advocacy where some people get paid for it as a career, but really, in truth, it should be a part of all of us as a part of our character, right?
That's true. So we're talking about a healthcare advocate, which is someone who's quote working for you, and you don't necessarily need to pay someone for this, but you definitely need to have someone on your team who could help you navigate, the healthcare environment, which is very confusing. Um, the best way to get a patient advocate is to find a primary care doctor, and hopefully through their office, they would help guide you. Now, obviously, your PCP is going to recommend and refer you to specialists and other places, but usually that's where it ends. So you'll get your referral, and now you're on your own to try and figure out how to get an appointment, or who to see. It's a very vast land. It's very vast. So it's not just a matter of finding the right person. Hey, it's finding the right person. Like, who is the best specialist for you to see? And we have limited knowledge. So when you have someone on your team who's knows who to send and how to help you, it's invaluable.
Yeah, that's actually a very interesting point. Like, for example, I go to a doctor that's part of a group, and most of the people that belong to that group are from the older generation. So whenever they're suggesting specialists to go to, they're usually specialists that have more familiarity with elder care than younger care, I guess, if that's what it's called. And so it's an interesting point you bring up, that it's not done on purpose, but a doctor might refer you to somebody that might not be the best fix for you simply because he has this ongoing relationship and has good feedback.
Right. So let's say you mentioned younger people. So you meant like young adults, but let's take it a little further. Let's say there's a teenager who needs to see an endocrinologist.
Okay.
So endocrinologists could help everyone, but if you would have an endocrinologist who specialized in adolescent medicine, well, that would be fantastic. But how would you know to find a endocrinologist who specializes in adolescent medicine? You wouldn't even know to think of that. And even if you did know that you wanted one, how would you go about finding one? So
Right.
in our community, we're very lucky that there are many organizations that help people, and you know they'll even not only give you the recommendation of who to see, if you can't get an appointment, they will either say use their name, or they'll say, we'll call for you. So in my office, what we did years ago was, so I set up an urgent care. And our urgent care doesn't just do urgent care, we do primary care and specialty care. So a common scenario is the provider is going to recommend a course of action, medication, a referral. What we do is we discover that no matter how clear you are in the office, when you call the patient the next day, they really are confused and lost and don't know where to go. And there's this language barrier. There's a language barrier that healthcare professionals use, which sometimes could have a different meaning than what is used in colloquial English. So it becomes very confusing. So to your healthcare professional, they are being really clear, they think, but you have no idea what they're saying. To make matters worse, a lot of times your healthcare professional is going to talk to you when you're either undressed, half undressed, where you're in a very vulnerable spot. So your brain is really not really absorbing what's going on. Some things that you may hear in the office could be really scary, but the intent is not to scare you. They're just using big words where you're not clear. So what we started was an aftercare team. And our team would call the patient the next day and ask them not only were they satisfied and happy with the visit, but to ask them if they have any questions or concerns, or if they received their medications, or if they made their referral, or if they need help with their referral. And then we help the patients get that referral.
That's interesting.
And now this is something that we do for free. It's not, we don't bill, we don't charge for that service. It's a service just to help close the loops in healthcare. With the advent of urgent cares and rapid care facilities, it's very much from the providers and the clinical side, they view their job as episodic. They're not the PCP. Now, I mentioned that we have a PCP, but in some clinics, there's no PCP. It's just episodic care, and the urgent care takes care of whatever the issue is, and then they refer you for more definitive care. And this is where it gets scary and it gets confusing about where to go. So, it shouldn't be surprising, but you call an office and you try to make an appointment and they tell you that is a 2-month wait. So right. What are some you as a patient can do to help get an appointment sooner? So before you call like my office, or if you know me and you call me and I help you, there are some things that you could say to the receptionist to help get an appointment sooner, which might work. For example, you might say, like, you can't start yelling at a person on the phone and saying, I need an appointment now. My doctor said I need to be seen and I can't wait 2 months. I mean, that's almost a guaranteed way to get no response, right?
Yeah, but I mean, that's the American way.
It's the it's one way, okay. But there's also another way, is being nice and right. Being understanding and helping the other person do their job and being appreciative. Mm-hmm. So if they tell you that you have 2 months, am available anytime to be seen if there are any cancellations. So you could ask them if there are any cancellations. You could go on a wait list, or you could say, I'm available. You could say, what days does the doctor see patients? So they'll say Monday, Wednesday, and Friday. And now today is Monday. So you could say, well, I'm available Wednesday. Do you have any cancellations? Now, they love filling cancellations. No one wants their schedule up and then have no-shows, right? Mm-hmm. So they're very happy usually to put you in as a, on the fly if there's like a cancellation.
Okay.
The other thing is, you call that you call one of these organizations, to try and help you, or you call your PCP, or if you're with us, then we would help you through our aftercare team.
Okay. So are you saying that this aftercare team is part of this urgent care group?
Well, it grew out of the urgent care because what I wanted to do was send every patient back to their PCP. And a lot of doctors are very cautious about poaching patients. So urgent cares, for example, could be viewed as an enemy
Mhm.
because the PCPs are losing patients. So what we do is we send the patients back to their PCP. Sometimes we'll even call the PCP on behalf of the patient, letting the office know that we saw your patient, we did so-and-so labs, and we're sending the patient back to you. And so now we're providing a service, not just to you as the patient, but we're providing a service to the healthcare professionals in the community.
That's interesting. So basically, you're an innovator. Basically, we've gone from emergency rooms to urgent care, which was a fantastic step. I mean, nobody in the world can complain about that, that you don't have to go to an emergency room, be around sickness and disease just to get a couple of stitches or, a small test or whatever. And now you're taking it the next step. And it would be great if all the urgent cares were to follow this strategy of having advocates. You call them an after hours team, an advocate team that's really capable and suave. I mean, you need certain types of employees. You can't just hire anybody to fill these spots. You need somebody, like you used the word, on the fly, somebody who can maneuver.
Well, right. So we don't want to say personal stories, but we had a patient who injured um, they had an injury. Okay. Well,
Hmm.
an Achilles strain, Achilles rupture, whatever it may be. They need to be seen by orthopedics right now. Let's say they have to be seen by orthopedics. Let's say so in this particular case, I happen to have a good relationship with a large orthopedic group. So I'm able to call the office and help the patient get seen like today. Now, there might be a little wait at the office because the office is busy, but many times I'm able to get someone to be seen the same day, and which is a very satisfying, thing to do.
Okay, so you're bringing up another point now, which is very key. You're touching on something I think that maybe I'm imagining, but I think I'm hearing something that there's more space on the specialist schedule card than you would actually imagine there is, because you're not squeezing people in if there's no squeeze room.
Right. So you got to imagine that a healthcare is a business. That might, to some people that's obvious, and to some
Right.
people completely not obvious. Healthcare is supposed to be a right.
Altruistic. Right.
It is, which it absolutely is. Right? No one that I know thinks about money when they're treating patients.
Right.
One is thinking about the profit margin. I mean, you hope not, but most people are not. So the way they make their schedules is that they always leave room for walk-ins and emergencies.
Hmm.
So a schedule might be full, but it's full only because they know that there are gaps to help people to come in. So
Understood. And you could use those gaps.
you could use those gaps if you speak nicely and you have a relationship. Then people are more apt to give you those slots.
Wonderful. That's so interesting. So yeah, as I was saying, it would be nice if more urgent cares had these kind of teams working.
Well, it's not just urgent care. No, urgent care. It's important for urgent cares to have these teams, but it's important for any kind of large medical organization to have a team like this. Um,
Agreed.
because people walk into their doctors, saying, I don't feel well, I want to come in today, and they come in, and now they need to be seen elsewhere. So a lot of organizations do have aftercare or, advocates, some more than others. But if your organization, if your doctor does not have it, there are external organizations that will help you do the same thing.
And you find them how?
The way it usually works is you have to ask around. You
That's
usually
fair.
ask around. Usually, you have to ask people who if you know any medical referral organizations. They're usually called referral organizations, and they
Mhm.
have a list of people that they have relationships with, and they'll help you get seen. They also know, it's pretty surprising. Um, not every person who's a specialist deals with every condition. Obviously, there are certain people who are specialists in particular areas, and it's not advertised. You need to know who it is who is the expert in that particular procedure. So let's say it's a surgery. Now, not every surgeon performs every surgery. Not every orthopedic surgeon performs every orthopedic surgery. There are people who specialize in particular areas.
Right. Right, right. That's fine. And again, these are not people you have to pay. They're making their money on the back end from the doctors or whatever, insurance.
Far as I know, no one is making money off it. When I do it, I don't make any money off it. It's something that we do, something that I do. If either my team would do it or I do it personally, but the other organizations all do it on a charity basis. They're not going to ask you for donations. They just do it for the community. It's a pretty amazing thing.
Interesting. I think that is as simple.
That's even crazier because these organizations will not only help you get an appointment, but these organizations, again, including myself, can help with transport, arranging transportation. Again, a not so simple thing. We're young and healthy, so it's easy to get where you're going. But not everyone has that luxury. Some people can't walk. Some people are in a lot of pain. Some people they need access to transportation. So we can help with that also.
Wow. Very interesting. I have to tell you, this is all second nature to you. But I think this is a fantastic interview we did because I think this is going to be incredibly helpful and eye-opening to, if not a lot of people, everybody. So I appreciate all your input and advice. I do want to say though, unless there was something else you wanted to share on the topic.
Well, there's one more thing I want to mention, and that is the other role that a advocate can help you with is collecting all of your medical information.
Hmm.
And this is something that we take for granted. Like, where is your medical information stored right now?
Right.
Now, in the old days, if you want to say that, it was stored in a file cabinet in your doctor's office.
Right.
And they would, fax information back and forth. So now the information is at your office plus at the specialist. But today, with the advent of, electronic medical records, you could have your records dispersed amongst multiple healthcare organizations, and they don't necessarily talk to each other.
I always assume that everybody sends the information back to the PCP, so that it's all there clustered together, like your accountant has your numbers. That's not the case?
Well, it's not necessarily the case, no. When you go to the emergency department and you get a battery of tests, they are not going to send your paperwork to your PCP. They're going to, these days, a lot of organizations will give you the discharge papers, and on that paper, it will have all of the lab results, and it's going to have all your diagnostic images and those results, but it won't have the images itself. For that, you have to request it from medical records. And then the medical records will send you a DVD, a CD of your ultrasound, X-ray, MRI, if that's what you need. Sometimes they give you the full medical chart, and sometimes they just give you a summary. So your PCP does not want the summary. They want the actual chart. They want to read the entire chart. So for that, you may need to go to the medical records department in order to get it. So let's say now you did that. What I'm saying is even deeper. I'm saying is, so that's one thing. So now you went to one place, they did some tests, and now it goes back to the PCP. But let's say now someone sent you to a rheumatologist because the ER could give referrals also. And depending on your insurance, you may not need a referral from your PCP. So now your PCP is not aware that you went to the ER and now you went to a rheumatologist. And believe it or not, most people don't know who their PCP is. That's because most people, especially guys, don't go
Part
to
of the
their
group.
doctor and they don't even know who their doctor is. You have to ask your
Oh,
wife or your girlfriend, like, who's my doctor again? And whatever's listed on your insurance card may not be accurate because that if you didn't list a PCP when you signed up, they're gonna assign you somebody. Now you're
right.
able to change PCP. Now you may not know how to do that, but we can help you change your PCP also. So one of the services that we provide also is helping you with these matters.
Fantastic, fantastic. Just something that comes to mind, as you're talking, is that like I went to an urgent care and I took blood tests, and then when I went to the doctor, they took it again because it didn't get transferred over. Something that simple that would have saved the energy. So yeah, it comes to mind, and that's just something simple, just shots. Um, so I think that this was really, really useful. I think that there's a lot for people to pull out of this. I really appreciate you coming on. Before you go though, I was hoping maybe you take a minute or two to because I know how much, acupuncture is, that's where you started, that's where you came up. Maybe you could share a little bit about how that happened and how you transferred to modern medicine. And then I
Sure,
will thank you for your time.
my pleasure. Before I say that, I want to say one more thing on this matter. So you could create your own healthcare team. Now it could be at least a family member or a close friend or someone that you trust to come with you to an appointment. Because when you're the patient, even me, when I'm a patient and I'm sitting in the office and they're talking to me, my brain is going all over the place. So it's helpful to have someone with me just to listen and maybe ask some questions. So it's good to have someone always with you. Now, after that, if there is a recommendation for a type of therapy or treatment, it's really helpful to get a second opinion, especially for surgery. And that person preferably should be a medical professional who understands that particular field of medicine. And after that, you want to have three people that you want to speak to, and one of them should at least be a friend who cares about you. And so that's another way of just helping you navigate, scary, medical mazes.
Because you're emotionally involved and they're trying to have more of a
Object.
practical, yeah, objective strategy. Smart.
It's to advocate for yourself. You have someone coming in and they're very prestigious and they got a big office and you're intimidated, even if they're super friendly, there's still that intimidation and you're to feel better. So even though you may have a list of questions, you may forget it. So another thing that's really helpful is writing down your medical history before you go to an office. That
Uh-huh.
is because when you walk into an office and then they ask you, well, what's going on? You start blabbering and you forget and you think the things that are important are completely not important to the visit. And the guy is really busy. And even if they're nice, you're saying things that are not relevant. So before you go to the office, when you are calm, you're able to write down like your history. You could jot it down as notes, as an outline. It doesn't matter, but you need some notes that will help explain what you're really concerned about. It also
Smart.
helps of your medications, and it's important to mention what previous therapies you've done. People are not aware of what therapies you've done in the past, and they may recommend you do something, and you're going to forget that, oh, I already tried that and it didn't work. Now, that is very diagnostic. Telling people, your doctor, what you've done that worked and even maybe more important is saying what you've tried that didn't work.
Right.
That's very Now, you wouldn't think that that's important, but it is.
It saves a
It's
lot of time and energy. And
that you are a conscientious consumer, and
right.
people to help people who help themselves. And by you being your own advocate, the whole energy shifts all of a sudden. And you'll see this. You start talking, and then you feel like you're not communicating exactly. You're sort of not getting from the other person what you're hoping for. And then you say, "Oh, wait, I have a paper which lists my concerns, the pain, where the pain is, the quality of the pain, what makes the pain worse, what makes it better, whatever your symptoms are, what makes it worse, what makes it better, how long you've had it, and what you've tried." It shows that now you are someone who actually cares. And people love helping people who are eager for help, right?
Interesting. It's also on the one hand, you need to show respect to a doctor, but on the other hand, if you start, gibbering and getting all flustered, they might not have, I don't know if the word is respect, but they might not take as seriously what you're saying as if you come in yourself with this confidence that I am aware of where I stand and I'm knowledgeable on my subject here.
Right. Well, you're knowledgeable about how you experience what it is you're experiencing. Only you know how you feel and what you want. You see, we assume that medicine is algorithmic. Like for everything, there's okay, next step, next step, next step. But what the algorithms in medicine utilized are these very wide branching, lines and boxes. So there's always many ways to treat the same thing. So while the doctor may say, you should try this, there's usually like 6 other things that are also available for treatment. Now, not everything is appropriate for everybody, obviously, which is why there is room for a conversation. Um, so I'm not saying don't respect, medicine or your doctor. Obviously, you need to choose someone who you respect and, of course, respects you. That's critical. I think these days you're seeing more and more doctors with way better bedside manners right now. There's
Yeah,
much more appreciation that it's not black and white.
right. True. Definitely noticed. All right,
Right.
thank you.
So regarding my background, I started off in mind body medicine, and the when you speak of mind body medicine, Chinese medicine, really, I could say, reigns supreme in that regard, right? So and Chinese medicine includes acupuncture, there's herbs, there's body work, there's a lot of things that go along with acupuncture, but I really appreciated how Chinese medicine, acupuncture really integrates the mind and the body, and I really like how it takes a very vast system and then gives you all kinds of maps how to integrate and work with the person. And the concepts of Chinese medicine segue really nicely into modern medicine, what we call Western medicine. So it works really well. So I enjoyed the work that I did, but eventually I realized that in order to do true integrative medicine, I needed to gain Western medical knowledge and the ability to order medications, diagnostic imagings, and doing procedures. So, because when I was doing acupuncture, what I discovered is that it was more parallel medicine than it was integrative medicine. So I was working with an oncology team. That was like the first acupuncturist to be part of the Columbia University network up in Nyack. And so the oncologists were treating the patient, and they would refer the patient to me, and I would do the Chinese medicine part, and then we would discuss. But both doing our own thing, so it was like parallel. It wasn't truly integrated.
Right.
So I became an NP with the goal of integrating. Along the way, I did a rotation in the emergency department, and I fell in love with that. It was just so much fun. I mean, a lot of work, but sense of like instant gratification. You know, you're healing someone's boo boo. It feels good. It was really really nice, and it's the exact opposite type of work of acupuncture. Almost the exact opposites. Not that you can't do acupuncture in the ER. I actually innovated. Not innovated. I would mention I started doing acupuncture, but injecting saline, and it started with the nurses. So people would, not feel well, and they would come up to me and for acupuncture, but you can't do acupuncture in the ER. If you have a nurse or you have an attending who just has 10 minutes, I can't do acupuncture. So I used these diabetes insulin needles, tiny, tiny needles. I would fill them with saline and I would inject them in acupuncture points. And the water, the saline, was the mechanism that activated the acupuncture point. And it worked great. The saline leaves no scars. It's completely, not dangerous. It's not painful, and it works really nice. So just a little aside.
That's amazing.
So in my role at the ER, I started looking at like the larger systems of my efficiency. Like I would walk in, I was in charge of, we had like 8 rooms that I was in charge of. I was an attending for the fast track, and I would sit in the chair before we opened, and I would tell myself, if I'm efficient, I'm going to get to go to the bathroom sometime in the day. I'm going to be able to have a snack. But if I don't, you could go hours and hours where you just cannot go to the bathroom. You can't get a bite to eat. It depends how busy and how efficient you are. So I started calculating things like, for example, I used to think that it was faster for me to get medication for a patient versus asking the nurse to get the medication. And then I found a study which showed how many steps people take in the ER in any given day. And they were mapping the steps of different people, and there was a lot of inefficiency in that. So I discovered through that process that if by delegating better and delegating more, I was able to discharge more patients faster, which makes everyone better. Because in the time it takes to walk over to the Pyxis machine to get the medication, and while you're doing it, it seems really quick. But surprisingly, when you delegate it, you're able to discharge like 2 patients in the same time that you would have had no discharges. Wow. So thinking about systems, and it was through this process that I left the ER and I started developing urgent cares. I built urgent cares, and I designed and developed not just urgent cares, but also larger multidisciplinary practices.
Amazing. What a story.
Thank you.
Thank you so much for coming on. I really appreciate your time. This is beyond informational. I really hope people tune in and check out this wisdom you've accumulated for the rest of us. Thank you. Thanks for coming on.
Thank you for having me.